Hello, greetings everyone. Good morning, good afternoon. In 1 minute, we will be starting our webinar. But then before we start, that I would like to just inform you about do's and don'ts during the webinar. Please ask questions. It's vital. But then your microphone is not working. So basically, you need to write your questions in the chat window. So please find the chat button on the bottom at the bottom, and then you can open the chat window and start writing your questions. If you are watching this on the stream, then you need to YouTube stream, then you need to write the chat questions on YouTube screen. And then don'ts, please do not keep your email clients open because the sound from your email can compromise your audio setting during the webinar. And we suggest not to leave the webinar in the middle because you may not be able to come back to the webinar. Now that I will just let the webinar starts, and I will let Simone to share the screen. And Simone, the floor is yours.
Good morning, good afternoon, and good evening to all. On behalf of the Food and Agriculture Organization of the United Nations, of the World Organization for Animal Health, of the World Food Programme, and of the World Health Organization, I'm glad to welcome all the partners, speakers, and participants of this webinar, Food Safety in the New Normal, as part of activities of the World Food Safety Day. On December 20th, 2018, the United Nations General Assembly adopted the resolution 73/250 proclaiming a World Food Safety Day. Since last year, every June 7th will be a time to celebrate the myriad benefits of safe food and raise awareness on its importance on the human health and well-being. Food safety is a shared responsibility between governments, producers, and consumers. Everybody has a role to play from farm to table to ensure the food we consume is safe and will not cause damages to our health. Through the World Food Safety Day, we pursue our efforts to mainstream food safety in the public agenda and reduce the burden of foodborne diseases globally. This year, the World Food Safety Day, in the middle of the COVID-19 pandemic, aims to draw attention and inspire action to help prevent, detect, and manage foodborne risks, contributing to food security, human health, economic prosperity, agriculture market access, tourism, and sustainable development in the context of the new normal. The COVID-19 has impacted consumers and business around the world. The food industry is playing a critical role in continuing to provide a food-safe supply to consumers while mitigating risks of the novel coronavirus. But how can we predict the new normal for food safety? How industries and other food business will operate in this context? While we are seeing an improvement on hygiene measures everywhere, having a possible positive impact on food safety, we are also seeing food workers getting sick due to absence of physical distance at some point in food industries. Food delivery services has increased during the last months. Restaurants migrated to this modality to survive, but what will happen after? Some people are cooking and baking more and more at homes while many others have nothing to eat. How can we prepare for the short and long-term future? So now, this is the moment to assess and to be prepared. FAO, OIE, World Food Programme, and WHO worked together to offer you this first webinar as a moment to discuss and learn from experts how will be the food safety challenges in the new normal. We will keep discussing how to adapt and how to be resilient to the new normal food safety issues. I would like to thank all the speakers that kindly accepted our invitation to share with us their experience and knowledge. So let's celebrate the World Food Safety Day. As you saw, we are doing a very interactive session. So for those who already didn't connected to Menti, please go to www.menti.com and insert the number 273285 and answer the questions. I will share now the screen, and then you all can see what are the questions. The first questions, while we are, give a moment, and then here is the first question. That's where are you from? We have already 287 answers. You can see here in the bottom, and we are creating a very nice cloud, word cloud with all the places from where we are connected. I will give you one more minute and then we are going to the next question. So please, if you're having any issue, go to www.menti.com and the code 273285 that we're seeing on the screen.
Now I see 331 people answering the question. I think some people are testing the speakers, so I keep talking. Maybe Simone, you can help them by keep speaking.
Okay. Yeah, we are seeing a lot of answers coming. I hope you're all listening to us. For those who are connecting now, please go to www.menti.com and then you put this code 273285 and then you can answer the first question. I think I can move now to the next question. But those who are connecting now, you will be able to answer all the questions, okay?
So the question on menti.com is what sector you are from. So please select one and then submit and let's see what distributions we have. Are you answering the questions? The question is what sector you are from. And there is an options and there are multiple options and you can select one and then it should show. Simone, do you want to show the results?
Are you seeing?
Yes, interesting.
Thank you. So, yeah. So to which sector do you belong? We have here academia and research, food industry, private sector, food producers and farmers, NGO and civil society, government, intergovernmental organizations. The ones who are from others, if you can please write which sector in the chat box, please. And for those who are connecting now, please go to www.menti.com and then use the code 273285. I'm seeing people raising hands. We're not able to allow you your microphones. Please answer, put your questions on the chat, please.
So it seems like we have so many people from academia sector, and the next one seems to be the government. Then we have some industry colleagues, and it would be some of us that coming from intergovernmental organizations, and then we see quite equal number of others, which I see in the chat box: food industry, government, okay, and veterinary sector, NGO, those kind of sectors that I see. So thank you very much.
Okay, thank you. The questions will be open for those who didn't answer yet. So please keep, later we will share another question, and then you have only to refresh the menti.com to be able to see the next question that we will share later. I will stop now. And again, thank you all of you that are dedicating this time with us to discuss the future of food safety in the new normal.
Thank you very much, Simone. So for the interactive session, now we know how to use Menti, and we will have more Menti questions, as I said. So I advise all of you to keep the browser open if possible, but then you can also access in the same way. Now we will move to the section on our activities in the region. FAO starts first, and then I will give the floor to OIE, WFP, and WHO respectively. First, please let me introduce myself. My name is Masami Takeuchi, a food safety officer at the Food and Agriculture Organization of the United Nations, regional office for Asia and the Pacific, based in Bangkok, Thailand. And I will briefly inform all of you what FAO does in the region. Meanwhile, please open the chat window now and start writing your questions if you have any. FAO implements a number of food safety projects and activities in the region. One of the signature projects would be to develop capacities on effective participation on the activities regarding Codex Alimentarius, an international food standard setting body. We have one ongoing ASEAN project on this matter, supporting all 10 ASEAN countries, namely Brunei, Cambodia, Indonesia, Laos PDR, Malaysia, Myanmar, the Philippines, Singapore, Thailand, and Vietnam. So hope that all of you, some of you from those countries. And FAO supports Codex Trust Fund project in a number of countries in the region. And new projects will be happening in some Pacific Island countries, including Samoa and the Solomon Islands. Also, in the last few years, we have been assisting Bhutan, Myanmar, Nepal, Sri Lanka, and the Philippines to improve imported food control systems within the One Health framework. And speaking of One Health, FAO has a regional project to strengthen One Health program to generate evidence on improved collaboration for managing cross-cutting food safety and plant health and animal health issues. Nepal, Papua New Guinea, and Vietnam have been actively working in this area. Also, since 2017, our region is piloting the initiative of food safety indicators. While we recognize the complex nature of the topic of food safety, understanding where a given country stands in terms of the capacity to manage effective national food control system is very important. Bhutan, China, Cook Islands, and the Philippines participated in the pilot project and produced excellent outputs, which confirm the effectiveness of setting specific national food safety indicators. And in conjunction to the Food Safety Indicator Project, Bhutan also introduced the initiative of food safety culture last year, which has been very well received by various stakeholders, especially in private sector, including small and cottage food enterprises. As per national initiatives under the FAO project, Bangladesh is improving national food safety institutional capacities, while Cambodia is developing standards for good agricultural practices, GAP, for national certification. Indonesia has gone through a comprehensive assessment of the national food control systems, and Thailand just finished a project to strengthen their food safety and quality control of livestock products. And interestingly, Pakistan is piloting the national street food safety program, while Mongolia is developing efficient food control management system. FAO also supports risk-based food safety policy development. It requires systematic collection of scientific data and evidence. And the challenge is that data needs to be reflecting the national context, meaning that regular and streamlined consolidation of national data is necessary. This is the area that many countries in Asia and the Pacific region express that they would like to improve big time. FAO is listening to all the needs from different stakeholders in the area of food safety, and we will continue providing technical support to build together the food safety world with all of you. Any food sold in any type of marketplace in any countries need to be safe for human consumption. There can be no exceptions. Remember, food safety, everyone's business. Thank you very much, and please put your questions in the chat box. And now I will hand it over to Ms. Lessa Thompson, OIE, please.
Thank you for the kind introduction and the opportunity to participate in this joint webinar in celebration of World Food Safety Day. The OIE, or World Organization for Animal Health, has a vision to improve animal health and welfare worldwide. We have a mission to improve the safety of food of animal origin from hazards originating in animal production through supporting veterinary services in member countries. There is an OIE representative, the delegate, in each member country, and each delegate appoints a dedicated person to be the national focal point on animal production food safety. Our delegates are responsible for negotiating international veterinary standards, which are published in the OIE codes and manuals. In turn, the OIE supports national veterinary services to comply with these standards. The section on veterinary public health in the OIE Terrestrial Animal Health Code outlines the role of veterinary services in food safety systems, meat inspection, animal feed, controlling antimicrobial resistance, and prevention and control of bacterial infections like Salmonella in commercial production systems. Aside from the importance of good veterinary services, we are also concerned about zoonotic diseases and understand that a One Health approach is critical to ensure that the whole food production chain is appropriately regulated and managed. The OIE collaborates with regional partners like today to promote multi-sectoral collaboration to improve food safety. 3 foodborne zoonotic parasitic diseases are included in the OIE list of diseases considered to be specific hazards and important in international trade, and these must be reported to the OIE. Antimicrobial medicines have advanced animal health and welfare, food security, and food safety. Safe food production practices will reduce the risk of spread of antimicrobial resistance. OIE standards and guidelines provide a framework for responsible and prudent use of these products in animals and for surveillance of their use and of antimicrobial resistance. With the growing demand for foods of animal origin, the demand for animal feed continues to increase. Ensuring animal feed safety has a direct impact on animal health and welfare, and also on food safety and human health. Last year, we held a regional workshop on animal feed safety in collaboration with the Food and Agricultural Materials Inspection Center, or FAMIC, in Japan. Following on from that workshop, the Laboratory Network on Animal Feed Safety in Asia and the Pacific was established. FAMIC is an OIE collaborating center. In Asia and the Pacific region, there are 5 such centers of expertise relating to food safety, covering food safety, foodborne parasites, and animal feed safety and analysis. The OIE tries to anticipate new sanitary and environmental risks. We need to be aware of the relationship between animal production systems, climate and environmental change, and the emergence and outbreaks of animal diseases. COVID-19 is a human disease which most likely emerged from an animal source and through widespread human-to-human transmission became a pandemic. While there is circumstantial evidence indicating likely transmission from farmed mink to humans, there is no evidence from risk assessments, epidemiological investigations, or experimental studies to suggest that live animals or animal products play a role in SARS coronavirus 2 infection of humans. We have prepared recommendations for members to continue to implement sanitary measures, to continue to facilitate safe international movement of live animals and animal products. Please check out our regional and global websites for more information on OIE food safety materials. We should all be involved in animal health and welfare because protecting animals is preserving our future. Thank you for your attention.
Thank you, Lessa. So now Carla from WFP, please. Thank you.
Thanks so much, Masami, and thank you for the opportunity to share our point of view. My name is Carla Mejia. I'm the Regional Food Safety and Food Technology Officer for the Regional Bureau for Asia and the Pacific. And as one of the lead humanitarian agencies that not only is tasked to deliver food assistance during emergencies, but also works with communities to improve nutrition and build resilience, at WFP, we firmly believe on the strong national capacities in the areas of food safety and quality as a priority in Asia to ensure that safe and nutritious foods can reach the supply chains that feed those who are most at need. This is especially critical now in countries that not only face the recurrent shocks due to climate change like ours in Asia, but also the economic downturn related to the COVID-19 pandemic. We have based our work on strong evidence for advocacy, as well as partnerships and collaborations with various stakeholders for implementation, and have prioritized 4 areas in these current years. 1, we plan to continue our risk-based approach to supply chain management for operations from farm to fork, from procurement, quality assurance and quality control, storage, shipping, distribution, etc. This, we hope, is grounded on the improved information management systems that we have. Additionally, we will enhance incident management and risk communication tools across the stakeholders, internal and external. We'll also focus on the evaluation and strengthening of local value chains, especially those that could support social safety nets, namely complementary foods, fortified staples, and fresh foods that can be used for school meal programs. We have ongoing projects across the region whose focus varies from wheat flour or rice fortification in Afghanistan or Bangladesh to fresh food value chains in Bangladesh and Cambodia and complementary foods in Pakistan. Last but not least, we are contributing to the strengthening of national institutions through advocacy and policy dialogue that fosters risk-based regulatory frameworks and standards, as well as an adequate infrastructure for compliance monitoring in various countries like Bangladesh, Nepal, Sri Lanka, and Bhutan. We believe that supporting local food systems to produce safer food, as well as small farmers and processors to engage in emerging markets, can achieve multiple outcomes at many dimensions to improve health, improve livelihoods, and enhance nutrition and equity. Thanks so much again for the opportunity. And with that, I would like to pass the floor to my colleague, Mr. Gyanendra Gongal, the Food Safety Regional Advisor for the Regional Office for Southeast Asia at WHO. Thanks.
Thank you very much. WHO has established 2 regional offices in Asia Pacific region to better serve our member states. One is situated in Manila, that is Western Pacific region, and one is in New Delhi, that is for Southeast Asia region. In addition to that, WHO has established Secretariat for Pacific Countries, SPC, to better serve the need of small island countries in the Pacific region. WHO, CERO, and WIPRO, we are working together, and we have framework for action on food safety for both regions, because we have different regional contexts. So that is guiding document for WHO to serve our member states, and that will continue till 2025. And in addition to that, we give more priority to regional partnership. So at the Asia Pacific region, we have Asia Pacific One Health Coordination Group together with FAO and OIE, and it has identified food safety as one of the priority area for interagency collaboration. And it is important to note that FAO and WHO, we developed assessment tool for assessment of national food control system. And for the first time in Asia, we use in Indonesia, and that is through FAO WHO collaboration with the government of India. And now we are supporting priority action to implement the recommendation of the assessment. And similarly, Codex Trust Fund is one of the funding agents source we have developed to support low and middle income countries. And for the first time in the history of Codex Trust Fund, Bhutan, India, and Nepal, they were able to secure funding for group activity, and that is ongoing. And we are very pleased to inform you that Myanmar submitted group application on the behalf of Myanmar, Laos, and Cambodia, and that is in pipeline. So in that way, if countries, they will work together, they can help each other, and it will strengthen sub-regional collaboration, and then it will contribute to international collaboration. In addition to that, International Health Regulation 2005, that is guiding document, international instrument for public health governance. And food safety is one of the 13 ISR capacities. And under that, we organize joint external evaluation where we have 19 technical area, and food safety is one of them. So far, 27 countries in the Asia Pacific region have done joint external evaluation. Based on that, we are trying to implement priority action through development of national action plan on food security. And we also work together with FOIE, and we have National ISR PBS Bridging Workshop that bring human health, animal health sector together. And so far, 5 countries, they have completed National ISR PBS Bridging Workshop. We are also supporting national codex structure. As OIE colleague has mentioned, we are also working on foodborne parasitic zoonosis in Luang Prabang, FAO, WHO. We supported regional workshop on foodborne parasitic zoonosis, which is endemic in Asia Pacific region. And we are also helping countries to establish a functional national codex structure, because codex standards, they are international standards, and countries are adopting that at the country level. We are also running this international network of food safety authorities, and it is to support national codex structure and promote cross-sectoral collaboration and information sharing in case of food safety emergency. And we also have regional meetings. We organized one in Republic of Korea, Seoul, and we had global InfoSan meeting in Abu Dhabi. And when we are talking about a public health perspective of food safety, we cannot ignore the COVID-19. And there is no scientific evidence to date that these viruses, which causes respiratory illnesses, being transmitted via food or food packaging. And it is important in all circumstances to maintain good hygienic practices. And it is time to adopt WHO 5 Keys to Safer Food during lockdown and COVID-19 crisis. And we also need to understand that COVID-19, these viruses cannot multiply in fruits and vegetables. Consumers are always advised to wash fruits and vegetables with safe water before consumption. And WHO, we believe in partnership, and we have issued a statement with FAO on for food operator, business operator, as well as National Food Safety Authorities, with WTO on food safety and trade. And we are working with a tripartite group, as well as World Food Program and UNEP whenever it is necessary. Thank you.
Thank you very much, Ganendra. So all of us on the screen, there are 5 speakers that we introduced our activities in the region. And those who really need more details about what we do in the region, we published a report with the transcript of what we spoke about. So don't worry that you will get the written material so that you will be able to understand further. And then our idea is to put some references so that you can further take a look at those activities. Now that I will just hand over again to Simone to log into the menti.com and then do the interactive part. Simone, please.
Thank you. Now we have a new question, and I will ask you to those who are able to connect to Menti, what new normal are you adopting for your food habits? You can choose up to 3 options. The ones that are choosing other, please write in the Zoom chat. And I'm seeing that some people that are not able to connect to Menti, you can please enter 3 answers on the chat, please. And for those who just connected, please go to www.menti.com, and then you can use the code 273285 that you can see in your screen now. So you're seeing how people is adopting new habits or using more some kind of habits than before. To help us to understand, a lot of people are cooking more at home, as I say on my words from the beginning. The ones who are lucky to have enough food we are cooking more at home, and I hope you are all cooking healthy food at home, not unhealthy food, please. Eating healthier, which is very good to see here in the screen. Cashless payment, which was also something enhanced now, even in the countries or in some services that were using more money. Now there's been, we can see now a more digitalization of payment options everywhere. Online grocery, a lot of people are trying to not go to the grocery stores. And Masami, if you can please, I don't know if I don't want to put the chat here in the screen but if you can see on the screen, if you see some other answers that are not here, please.
I think people are saying that they prefer home-cooked food. That is something that I see a lot in the chat window. And then others, I think they only 5 selected, so I really cannot find the options in the chat window. But then I just want to inform those who are watching over YouTube live stream, we have certain slight, but then certain time lag. So you may not be able to see this on the menti.com. So in that case, that please tell us using the chat window to choose the options from the screen: cashless payment, ready-to-eat food delivery, online groceries, cooking at home, eating healthier, contactless food delivery, eating more, eating less, eating alone, others. So it's very interesting that some people eating more and then some people eating less. So it's very interesting. But at this moment, number 1 seems to be cooking at home. So they trust themselves. Over to you, Simone.
Thank you, Masami. And an interesting data from all of us connected, that we have 300 participants in this Zoom chat. but we have about 500 in YouTube. And I'm seeing that even here that we have one connection, we can see that a lot of places we have a lot of people in the same room. So we can have much more. We actually have much more than 300 in this Zoom. And we saw in the YouTube that someone say that was showing this video to 53 students. So we have much more than 1,000 connections right now with us discussing the new normal for food safety. And I'm very happy and thankful for all you that came to connect with us and to share with us your questions, your comments, your inputs. I think it's a very important moment for the region to understand what is going to happen now and how we can, all the international organizations involved in this organization of this webinar can be able to help and to provide support to the countries. I will get back to now to our colleagues from the panel for the next part of this webinar, and we'll be back by the end with some more questions.
Thank you very much, Simone. Thank you. Excellent. So now that I have this is my pleasure to have the Senior Food Safety Officer of FAO, to the Mr. Sridhar Dhamapri, who will be moderating the next panel discussion. And then Sridhar will introduce three very remarkable, excellent regional experts. Sridhar, over to you.
Thank you, Masami. And also thank you, Simone, Carla, Gyanendra, and Leza for giving us, everybody, a very good introduction to the work that all our organizations are doing in this region. So it is my pleasure here to moderate this discussion with three very illustrious people who have a big role in food sector as a whole and definitely in food safety. Before I start off the panel discussion, I just wanted to again re-emphasize what my colleague Gyanendra has already put on the chat. There is no evidence that food transmits COVID-19. So please eat what you like. Please observe all the food safety behaviors like washing fruits and vegetables. Ensure you follow all the health measures such as physical distancing, wearing a mask, and frequent hand washing. But do not deny yourself your favorite food, and do not forget to order when you need to. So that's an important message that all of us want to give out, and that will also come up later when we introduce the infographics, of which you will hear later. But first, let me start off this panel discussion by first introducing Dr. Junshi Chen from the China National Center for Food Safety Risk Assessment in China. Now, those of us who work in the area of food safety are very familiar with him as a veteran in this area and with wide experience, particularly in China. He graduated from the Department of Public Health, the Beijing Medical College in 1956, and has been in the area of nutrition and food safety for more than 50 years. He is at the Institute of Nutrition and Food Safety, the Chinese Center for Disease Control and Prevention, Beijing. And since 2011, he has taken the position of Senior Research Professor and Chief Scientific Advisor at the China National Center for Food Safety Risk Assessment. So as you can see, his major research interests are food safety risk assessment, risk communication, epidemiological studies on diet, nutrition, and chronic diseases. Welcome, Dr. Chen, to this, and thank you for taking the time to be here. I would then like to introduce Joanne Chan, who is at present the Center Director, National Center for Food Science of the Singapore Food Agency in Singapore. She has a double role. She's also the assistant professor at the National University of Singapore. She has been in this area for more than 28 years. She has contributed extensively to building laboratory capacity for Singapore's food safety system, and is also heading the WHO Collaborating Center on Food Contamination Monitoring in Singapore. She co-chairs the Council Committee Testing of the laboratory under the National Accreditation Council in Singapore, and is in the advisory panel of the National Chemical Metrology Program in chemical the testing. Therefore, here's an expert very much from the laboratory side. And thank you, Joanne, for joining us on this discussion. Last but not the least, let me introduce Vishal Bhatia, who is the Chief Executive Officer of New Supply Swiggy. Swiggy is India's largest food delivery e-commerce player. It is delivering more than 40 million orders a month, has over 4,000 employees, and has a business valued at 3.6 billion built over the last 5 years. He aims to create this into a profitable $500 billion enterprise in about 3 years. He has been an entrepreneur all his life, a business leader with 21 years of experience in blue chip organizations, including Reckitt Benckiser, PepsiCo, and Britannia. And we hope that he will bring to the table some of his experience with app-based deliveries and on the new markets that this is opening up. So without any further ado, let's get straight to the questions. And there are a number of issues in this region which we would like to raise with all of you and know your valued opinion. So Joanne, first to you. Singapore has seen a lot of changes in the last few years, especially in food safety. What do you think are the 2 or 3 really significant ones that you can tell us? Over to you, Joanne.
Thank you, Sridhar. Hi, everybody. In Singapore, the food regulatory landscape has undergone significant change in the last couple of years, with the formation of a central agency, which is the Singapore Food Agency, on the 1st April 2019, with a mandate to ensure and secure a supply of safe food. This review consolidated all food-related resources and capabilities previously shared by 3 public agencies under 3 different ministries into one agency for holistic management of the food industry from farm to fork. The integration facilitates better partnership with all key stakeholders to develop new capabilities or solutions to address new food challenges and seize future opportunities. On a broader scale, we also strengthen the food safety through a One Health approach, with collaboration amongst different government agencies responsible for human health, food safety, animal and plant health to achieve optimal health outcomes. This is particularly important in the foodborne illness outbreak investigation. Thank you.
Thank you, Joanne. So we've heard, so Joanne has explained the background to how food safety agencies function. So here, let me just go to Vishal, who is effectively from the private sector. So Vishal, how do you see your role in food safety enforcement and in implementation particularly? Do you think that the private sector is delegated enough, or it can do much more on its own? How do you see the picture? Over to you, Vishal.
Hi, Sridhar. Thanks at the outset for having me in this August company. I hope everyone's keeping safe and staying healthy. On the particular question, Sridhar, I think India is obviously a very large country, right? And the regulatory authorities have their hands full in terms of managing and guiding both the industry and the consumers towards safe choices. I think from a delegation standpoint, the approach that the regulatory authorities in India have had has been largely collaborative and has promoted the industry to be more self-regulated and build practices themselves to ensure safety for themselves, their employees, and the consumers at large. I think the current pandemic was a fairly good demonstration of a quick reaction by the regulatory authorities when something as unprecedented as this has obviously affected everyone, and helped us co-create strong safety guidelines to work towards consumer safety and employee safety. So I think the approach that the government obviously has had is been largely collaborative and promoting the industry to take actions by themselves. Obviously, things it can always be better, but I think it's been a spectacular effort so far.
Thank you, Vishal. So, Dr. Chen, maybe we can go over to you, just picking up from what Vishal just now said about the quick reaction from the government agencies, which I'm sure definitely happened as well in China. You have seen it all the changes that have happened in the Chinese food safety system over the last 50 years, and definitely significantly over the last 10, 15 years. So what are the key changes that you have seen? And then how do you see the reaction to this particular crisis? This is a health crisis. It's not a food safety problem. Yet we have to keep both in mind when we talk to the consumers. Over to you, Dr. Chen.
Thank you very much for the questions. The food safety improvement in China, it started from the melamine crisis in 2008. After that, we had several important improvements. One of them is China has developed its first food safety law. And the second, the risk-based management has started, in particular in the development of a food safety standard that is based on the risk assessment. And also, the Chinese industry has totally changed their food safety practices, including more investment and a higher requirement in their products. And also, the Chinese consumers increase their awareness of food safety. And to answer your question of the COVID-19, as you correctly mentioned, COVID-19 is not a foodborne disease. However, it also affected the food safety in many aspects, from the production to the consumer cooking at home. I think these impacts are all quite positive. People have more idea and also more higher demand on food safety, even though the disease is not transmitted via food. And I think these kind of trends will continue after the pandemic. Thank you.
Thank you, Dr. Chen. So those were very wise remarks indeed. The fact that the food safety because of the increased emphasis on hygiene, hand washing, sanitization, physical distancing. So these are good points to take forward as we now start talking about the new normal, because the world probably has irrevocably changed in the last 6 months. And so all of us as professionals, as business people, as consumers have to start doing and thinking differently. So the question to you now, Vishal, would be that from this point on, what are the things you would like to see as that need improvement? There is now a broad awareness of cleanliness and hygiene. And as some of our colleagues have talked about the 5 keys to food safety, but you are the last link in the chain as the delivery app. How does it work for you? I mean, what are the kind of responsibilities that you need to take, have been taking, and you need to take more? And what are the kind of, if I may ask, what are the kind of complaints that you get? Do you get complaints of food safety, or is it only service related? Over to you.
So Sheila, there are 3 things that you've asked me, and let me kind of break that into different aspects. One is what can be better. And the first thing that I would say is, I think there is still a phenomenal role to be played to educate consumers about what safety truly means. I think forums like these obviously do a lot of, have contributed a lot in terms of making consumers a lot more aware on what food safety challenges are and how they can be mitigated. That's clearly one, and a lot more can be done there. I think the second is the training and support to the industry at large. In India, the industry hasn't been as organized. It's a largely entrepreneurial driven industry, and a lot of people do independent businesses on this. So therefore, structured training programs to drive food safety and compliance will obviously go a long way. I think third, of course, is then, penalizing or rewarding people who are truly being regulated or truly being compliant with what the regulations are and what the guidances are. And the fourth, of course, is, we need a strong regulatory body, which obviously keeps looking forward. I think that's the one part of the question as to what can be done better purely from an environmental standpoint. I think secondly, if you were to ask me, the things that we've done in this changed environment, I break it into three parts. One is just from a consumer standpoint. So there is a consumer and there is a restaurant, and we are largely the link between the consumer and the restaurant, right? So consumers order from the restaurant and through the delivery app. That entire journey is fulfilled. From a consumer standpoint, we've taken a lot of actions in terms of just guiding consumers, creating hygiene badges, guiding them to the right kind of restaurants, giving them as much information as we have, and very quickly reorganizing ourselves to collect information to make food safety pretty much a primary driver in the consumer choice. So that is something that we did uh, very early on in this entire pandemic, and we've seen a large part of our consumers appreciate that and navigate through their journeys because of that. So because a lot of consumers actually depend on us to fulfill their daily food requirements, I think that's gone a long way. The second is then from a restaurant standpoint, and we worked very closely with quite a few restaurants to not only train them, but also in terms of getting information from them, recording temperatures of their chefs, transmitting some of our best practices that we use in our own kitchens. So at Swiggy's New Supply, we run quite a few of our own kitchens, and we've got best in class standards, both on safety and hygiene, wherein we maintain norms around social distancing, using masks, sanitizers, regular hand washing, recording temperatures. We have a zero tolerance to any deviation from the defined protocol. And this is something that we worked with our restaurant partners as well. And we kind of made sure that they were following pretty similar practices. And then thereafter, we obviously started recording a lot of their information. That took a bit of time, but I think we are today in a place where a lot of our restaurants are sharing a lot of information about food safety and how they comply with the defined norms. The third and the most critical piece, we are a delivery organization, and we've got a very large fleet of more than 200,000 delivery executives who deliver food on a daily basis. I think that was a mammoth exercise wherein to train these our delivery partners to use masks, use sanitizers. We very quickly launched into a contactless delivery service, and therefore these delivery executives were trained how to do contactless deliveries, how to ask consumers that I'm going to leave it at outside your door. In case the consumer preferred to have a contact delivery, thereafter to make sure that before and after the delivery the hands are sanitized, maintaining distance from the consumers. So that was something that we did. Also, the use of the Arogya Setu app is obviously done very extensively. It's scanning temperatures of our delivery executives at every point and communicating that to our consumers through the journey. So these are some of the measures that we've taken. The last question that you asked me is, do we get food-related complaints or do we get delivery-oriented complaints? We get both. We obviously, the consumers actually think that we are as responsible for the food as for delivery. We are actually a delivery platform. But given that the transaction happens through our platform, in a lot of cases, if the consumer has an issue with what is being delivered, we do take it up with the restaurants and we try and solve it for the consumer. So therefore, we do take accountability for the consumer experience, and we try and make sure at all times that the consumer experience in no way is getting compromised.
Thank you, Vishal. Thank you for sharing that information. So, Dr. Chen, Vishal talked a lot about from the consumer side and also from essentially the last two links in the chain from the restaurant to the consumer and how they were making both of them aware of good practices. So in your view, what are the new things happening in industry, in food safety management in terms of researchers or technologies which can really provide impetus or a fillip to food safety? Over to you, Dr. Chen.
Thank you, Serena. The question is on the food safety, from new researchers, new technologies. I think, as we all know, the food business have the major responsibility to ensure food safety for the whole food supply. So technical innovation is very important for food industry. I can give two of those examples. One is the traceability. And I think in China and also in the whole Asia, as I understand, the food industry is trying very hard to use all kinds of technologies in developing their own food trace system. And according to their own stage of development, it could be electronic or even on the paper. And the second example is the whole genomic sequencing. And the high level food industry, especially the manufacturers, are trying to use this whole genome sequencing technology in their own field to ensure the food is safe. Of course, the technology cannot do that, but it will make from the farm to table and in any of those significant part of the whole food value chain, the significant issues, what happened, for example, the bacteria contamination that will easily identified and so solved quickly. So I think the industry, food industry in the whole Asia region, they're quite varied in their stage of development. But as an overall, new technology is critical in ensure further food safety. Thank you.
Thank you, Dr. Chen. So that actually brings us to the fact then, what are the kind of changes that actually might be needed in this new environment, both in terms of where we are in the pandemic, but as and when the pandemic will recede at some point, and then how do we continue? And there are important changes going on in Singapore, as I understand, Joanne. One of the things that Singapore has got is this 30 by 30 initiative, which is to produce, and correct me if I'm wrong, to produce 30% of its own food by 2030 and reduces import dependence. So there's a different way of thinking. Most countries are in this region are more into ensuring trade, but here a country here is now trying to become a little more self-sufficient. So what are the changes then that will involve for the Singapore Food Agency and the way they do business? Over to you, Joanne.
Thank you. So you've rightly said that. So I'd like to share three key challenges from the Singapore's perspective. So the first is to maintain food security in a time of global supply chain disruption. So the current coronavirus pandemic has clearly revealed the vulnerabilities. As Singapore imports more than 90% of our food, we are subjected to the volatilities of the global food market. To achieve this food security, we will focus on managing our food supply in three baskets. One, to diversify our food sources. Two, to support our companies to grow overseas. And thirdly, to grow local under our 30 by 30 vision, in which Singapore strives to achieve the goal of meeting 30% of our nutrition through local food production over the next 10 years. The second challenge is to mitigate food safety challenges arising from new business models driven by changing consumption behavior, such as novel food, convenient foods, and also increasing consumer expectation in food safety. As consumers switch to more convenient food and buying daily necessities and fresh produce online, this has downstream implications on the food system and will require regular review of our food safety policies and control measures. So in the area of novel foods such as alternative proteins, we have implemented a pre-market safety assessment process and published a guidance to help food traders better understand the safety assessment requirements and the application process. In order to address the rising customer expectation, we are also working with the food business operators to upskill the workforce through enhancement of the training and competency framework for food hygiene and safety for the food hygiene officers. We also collaborated with them to develop and encourage the adoption of national standards for new business models. So for one example is the development of a standard on the sale of food online. The third challenge is actually for us is to manage the search of fake news or misinformation from social media, which can undermine consumers' trust in the food safety system. So we need to develop a comprehensive risk communication strategies, utilize a lot of data analytics to obtain food safety insights, and strengthen our governance on scientific communication to boost consumer confidence and trust in our food safety system.
Thank you, Joanne. In fact, you have actually led us to our next topic. And this is probably as important as anything in food safety right now, and that's about fake news. There's enough anecdotal evidence to show that probably fake news is doing as much damage as the pandemic itself, or probably, who knows, even more. So maybe we can just have a, Joanne, maybe you can just tell us a few things that what you're doing in terms of combating fake news. How do you spread the message? Who are your targets? And how do you actually do that? Over to you. Joanne, are you?
Yes, yes, I'm online. So in terms of fake news, what we have done is that we have met up with the industries. We have issued actually things like FAQs for the industries. We have engaged them, find out what are the concerns, and publish this on our website as well for the industry so that they can, to alleviate any fears or misinformation as well. At the same time, we are also monitoring a lot of feedbacks from consumers. So we are responding to their concerns and publishing all these feedbacks to help them to manage this fake news.
Thank you, Joanne. And so while we are talking about this, as we mentioned earlier, there will be the infographics, which will be released at the end of this webinar by all the 4 organizations. They are actually meant as a means to combat fake news, and you will know that later. So can I just pass on the same topic to Dr. Chen? How does it, in China, is there fake news? And what are the kind of measures that are in place to make sure that they don't spread and cause damage? Over to you, Dr. Chen.
Thank you for the question. The fake news or the rumors on the food especially, in my opinion, this is the second major food safety issues in China. Of course, the number 1 is foodborne disease. My argument, this is the second important food safety issue. This is because the rumors, the fake news, they affected the consumer's trust to the whole food supply. And they make the consumers do not trust the food industry and also do not trust the government regulatory agencies. So I think this really, we have to take seriously on the impact in addition to the health impacts. That's the traditional food safety issues. In order to deal with this fake news, I think the usual way in China is to the government to ask the experts to refute these rumors or fake news, to tell the truth from the scientific point of view. Of course, this is necessary, but I think the fundamental way to fight with fake news is to improve the consumer's knowledge on food safety. If consumers have a basic food safety knowledge, they can easily identify which of those news are fake, such as are real. So I think this is the fundamental issue, and of course, it's a long-term way. And one more idea is, I think we have a focus too much on the word risk. And for consumer, they want to have a zero risk, of course. This is not existed. So recently, we are trying to develop a concept to broaden the risk communication to a much broader scope. We call it food information communication, because food not only has a hazard and a risk, but also a very good aspects like nutrition and taste, etc., etc. Over.
Yes, thank you, Dr. Chen. Indeed, I mean, it really shows the value of having somebody as experienced as you to advise on this matter. This is so essential. So, Vishal, what are the issues you face in terms of fake news? You obviously have a very strong interface with the consumer and the small businesses who probably do get affected as well. So, what do you face and how do you handle it? Over to you.
I think, Sridhar, we do face, we've not had many elements of fake news. Obviously, there are obviously apprehensions that consumers have and that have impacted a lot. We try on our own to, I think the way to counter fake news is to have high degrees of transparency and education. And we, through our own channels, try and ensure that we give consumers as much information about about the food that they're ordering or consuming that we give. I think the key has always been for us to make sure that we are proactively communicating with our consumers across channels and giving as much information to them through their buying and delivery journey. I think having an open two-way communication is absolutely key to making sure that fake news eventually dies out. I sincerely believe that that's pretty much one of the strongest ways by which fake news can be countered.
Thank you, Vishal. Okay, so what we'll do now, you'll just have another couple of comments from our panelists, and then we can see any interesting questions that we have from the chat box. Obviously, there is a lot of discussion on the COVID-19 that we can see, and I'm glad that all our colleagues from WHO, WFP, and OIE are actually doing a lot of answering some of the very common misconceptions that are in vogue right now. So thank you everybody for that. So what I could like to now ask from all three of you is to have now a little more of your own comments and inputs as to what are the kind of things that you see that international organizations like the four of that are organizing this webinar, what can they do more in each of these areas? So I would actually like to start with Joanne first. What do you see as the role for multilateral, multi-governmental agencies like ours, and how we can contribute to improving food safety, food control systems, and its SOPs? Over to you, Joanne.
Thank you. We hope to see the One Health approach implemented more widely amongst all the international organizations through greater collaboration and coordination in communication, such as providing joint release of your analysis, risk assessment, technical guidance, perhaps via a common online platform on common issues. In terms of food safety, we see food standards as very important, as differences between countries can have serious consequences, such as rejection of consignment by an importing country, leading to destruction of food and trade barriers. Therefore, a single internationally recognized set of food safety standards would benefit all countries in terms of resources for inspection and testing. It will also reduce disputes about the safety of food by different countries, thereby facilitating international food trade. So in this aspect, the Codex Alimentarius Commission, established jointly by the FAO and WHO, plays an important role in setting of these international food standards based on risk assessment in contribution to safe food for everyone. Over to you.
Thank you, Joanne. So, Dr. Chen, what do you think is some of the work that the international organizations can continue to do in this area? Over to you.
I think the most important thing that international organizations can help the member state is capacity building. Especially in Asia, we see very clear. The government is willing to improve the food safety, but their lack of capacity. And as the new science development and the technology development, there are a lot of new things happen, and they will need to learn. I give some priority areas in the capacity building. One is the risk assessment. It's very clear. It's not only any country need to have their own group, expert group, but also the regulators. They are not scientists, but they need to learn the basic knowledge of risk assessment. Actually, in terms of risk assessment, the regulators, they are the boss. The scientists was assigned their job to do which program. So I think this is very needed in this area. And also the inspection. All the governments in Asia has paid a lot of attention in inspection, but how to have the capacity to do the real risk-based inspection, not only relied on the end product sampling and testing. And finally, international collaboration. In addition to Codex, I think most developing countries, they really need the opportunity to learn from the outside experts. So through the international collaboration activities and projects, I think they could learn more and get better capacity in their own work. Thank you.
Thank you, Dr. Chen. That was indeed very educational. So can I just pass it on to Vishal and actually ask the same question as to what role do you see of the international organizations? And then maybe a follow-up before I go back to the other two panelists. You are in a country which has a huge population, and it's in most settings in South Asia and Southeast Asia are quite similar except for the population. So is it more advantageous to have more laws and regulations or less laws and better delegation? Over to you, Vishal.
So firstly, from the collaboration standpoint, I just want to add two more things. I think one of the things that from an international standpoint, we can do a lot better on and get a lot of help from is to make sure that there are stringent measures against misrepresentation, whether it's in terms of ingredients or it's in terms of claims. I think there's still a lot that goes around, and that comes in the way of transparency that I spoke about earlier. So a stronger guideline against that, I think, would be most useful. I think the second thing there where large global organizations could help are in areas like putting playbooks for different kinds of industries in different kinds of regulatory and industry environments and countries that that industry can quickly adapt from and look for. So that's from the first question, Sridhar. I think the second piece is I would be second guessing an answer here, but let me give you my perspective on this. I think it's always better to build regulation in a way that the industry finds it easy to follow and implement with having strict guidelines in place, right? So I think it's a very fine balance to make sure that safety and industry growth actually happen hand in hand. It's a hard job, which is why I never complain about the regulators, because I think they've got a very tough job on their hands. But having said that, I think there has to be a balance between making sure that we are all doing the right thing. We are doing the right thing for the consumer and giving them the safety guidelines, but it's not becoming so stringent that the industry is going to not grow. At the end of the day, we are all in a business and we need to make it grow. So it is a fine balance. I would not be doing justice by saying how many laws do we need, but I think it is a fine balance where guidelines are always more useful, and self-regulation and self-implementation, I guess, is the way forward for the industry at large. Thank you.
Thank you, Vishal. So Joanne, I mean, what would you say to that? The balance between regulation and self-regulation, delegation, how do you see that?
I think to ensure safety, it's always it's a fine balance. It's a joint responsibility. I see government putting in place a regulatory system that's transparent and also an enabling environment to ensure food safety. So that there should be constant dialogues with the industry when you develop standards. Not everything needs to be law, a regulation, but you can have some kind of good practices that you develop to help them improve the food safety. So that continual dialogue and engagement is very vital. And of course, if there is a if you do a lot of risk assessment and certain things are higher risk, these are the control points that you have to put in certain measures to work with them. And if that's it depends on how widespread the how vital it is in terms of food safety. If it serves a certain vulnerable population, so maybe there's a need to put in a heavier kind of measure like a regulation to protect the public health. That would be my perspective. Yeah.
Thank you. Regulation to public health. That's a good phrase to have. So finally, Dr. Chen, what do you think? You have seen it all, the establishment of a regulatory system for a really big country and economy. What is your take on this? How do we strike the balance?
This is to speak on the topic, it's easy, but to really do the best, that's not easy. So I just don't want to spend too much time and just emphasize that the government and the industry, they are not enemies. This is very important. And they have some mutual respect, mutual trust. The government need to understand the situation of the industry is facing. Usually, at least in China, they don't. And the industry need to sit on the government's chair to think about their position. And also, again, of course, if both the government and the industry could, based on the same science principle, that is based on science, based on the risk, then I think they could have the common knowledge, and that will be the ideal balance. Over.
Thank you, Dr. Chen. So indeed, I mean, that's a good message. Government and industry are not adversaries here, they are partners. So we are very close to the end of this discussion. So before I close, I just want a quick few words from each of you. And this is that what would be your message to your key stakeholders? We have today's theme for Food Safety Day, which is food safety, everybody's business. So what would you tell your stakeholder today if you were having a call like this? So Joanne first.
Thank you. So our message is that food safety is a joint responsibility. The government, the industry, and consumers all have a role to play in ensuring safe food for all. Government will put in place a regulatory system and enabling environment to ensure food safety. The food business operators plays an important role too, to ensure the safety of food it offers to the consumer. Food producers, manufacturers, importers, and distributors should adopt high food safety standards through implementation of food safety management systems such as the HACCP, supported by a team of food handlers who will observe food safety and hygiene practices. So finally, consumers need to take up an active role of ensuring food safety by adhering to good food hygiene practices and by making informed food safety decisions. Over to you, Sridhar.
Thank you, Joanne. So Vishal, what would you say?
I think a lot of folks might think of food safety and investments in food safety as a cost. I think of it as an investment because in the regime of today, consumers are going to be looking for more and more assurances and more markers for safety and trust. I think if the industry at large starts looking at this as an investment in the future to make sure that the consumers are feeling more and more assuaged and reassured, it will drive their business, and therefore it's obviously going to be an investment well worth it. I really like what Junshi said. I think it's phenomenal to hear that industry and regulators are not enemies. They need to work hand in hand, and I completely endorse that view as well. But more than anything else, and more than any other time, there needs to be a lot more investment and a lot more focus towards food safety right now to make sure that the consumers feel reassured more than ever before.
Thank you, Vishal. I mean, that's an excellent point. Food safety is an investment. It's not a cost. So Dr. Chen, you have the last word here. Please, over to you.
I fully agree with what Joanne said. All the different stakeholders has their own responsibility. So it's everybody's business. But in this occasion, I would like to emphasize the consumer side. Most consumers only believe they have the right to ask for safe food, ask for the government to make sure, and ask the food industry to provide the safe products. But I think in this World Food Safety Day, we need to tell the consumers, you have to protect yourself. Of course, you need to learn more knowledge to protect yourself. The WHO's 5 keys on food safety, I think these are very good. If consumer can fully implement these 5 keys, we could have a much less foodborne disease than it's now happening. So that's my point of view. Over.
Thank you, Dr. Chen. And thank you, Joanne. Thank you, Vishal. This was an amazing discussion, and it was great to hear from all of you. And I would just like to tell all those who are on the call to at least if not by sound, but at least to acclaim electronically on the reactions for a wonderful conversation that they have gifted us with. And I thank all 3 of you for your time, for coming here on this webinar and sharing your knowledge with all of us. So thank you once again, and I pass it back now to Masami.
Thank you very much. Wow, that was a very interesting discussion. Thank you so much. And also that I have been monitoring those questions. Some of them have been answered by this discussion, but then many interesting questions, especially from my personal point of view, these philosophical questions about high standards versus essential standard, or something like who pays for this investment, or those kind of very interesting questions that I promise that FAO, OIE, WFP, and WHO will work together to answer all the questions you have posted. So and then we will inform all of you about the report, hopefully within a month, and then you will have all the answers, written answers from us. And with this, I will pass the microphone over to Carla from the WFP to summarize this session. And after the summary, that we will have a short evaluation, and then after that, you will receive your e-certificate. So Carla, over to you.
Thank you, Masami, and many thanks to all the panelists for the very engaging discussion that I hope helps the audience as much as it's helping me thinking forward on how our food safety systems need to evolve in order to face the current and future challenges through reinforced knowledge of safe food handling practices across the food systems, to improve information systems, consumer-focused communication strategies, evidence-based regulatory frameworks for public health, and certainly gave me a lot of food for thought on our role as multilateral organizations, all aimed to share the daunting responsibility that is food safety. And before we close this event, I wanted to share with you all just one highlight of our joint efforts to communicate to the public. These are our food safety infographics and aim to emphasize the fact that food is not known to transmit COVID-19, and to highlight some of the basic safe food handling practices that the public needs to be aware of and practice. Hopefully, we all can use them in our respective platforms, and we can share further to ensure that accurate information is available. And with that, again, I want to thank our panelists, the colleagues at sister agencies, FAO, WHO, and OIE, that made this event possible. And most importantly, I want to thank the audience that remained very engaged throughout this event with excellent questions, very keen observations. And with that, I want to conclude these events, and I would like to pass the floor to my colleague Simone for a last question from Menti that would help us all on future events. Thank you all.
Thank you very much, Carla. Now I am sending to you another question. You please refresh your screen if necessary. And please, there are another question after this. I will give you a few moments to answer this, and then we will move to the next one. I will share my screen. This is to help us to evaluate how satisfied are you? Although we are seeing on I am following the YouTube chat and here as well. Very good, excellent questions, very interesting questions that came, and also a lot of very interesting compliments from our participants. I hope people from YouTube are able to also to connect by Menti, menti.com, and then the code if you're not. And then I will go to the next, I will release the next question. So the ones who are able to, were able to answer this will be able to go to the next one. So the next question is, what topics would you like us to cover for next food safety webinars? As we mentioned, we have been so very good, interesting questions and suggestions. We had almost 1,000 or maybe more than 1,000 participants. So we want to hear from you. What topics would you suggest us to for next webinars? So then we can be able to organize according to your preferences or your needs. So yeah, we are having a lot of questions now. I probably will not be able to show you all the answers because it's a lot here. I hope you are seeing, but we will include all this information in the report mentioned by Masami. We will include, and then we will also categorize the most voted to be our next webinar. I understand that it's been very interesting discussion. I hope you all, I will let you some time to respond. I will not close the Menti session for the next minutes. Even if we disconnect here, I will keep the Menti session open for those who are not able to connect and those who are still thinking about, to give you some time to decide and to write here your ideas, your suggestions. On behalf of WHO, I really thank you all for the participants, also for our very distinguished panelists. And now I'm giving the floor to my colleague Massam from FAO to explain you about how to download the certificate of this session.
Thank you very much. Thank you, Simone. Thank you, everyone, for your active participation. Excellent questions, wonderful panel discussions. And then here is the link on the screen, http the column / tiny.cc/ and in capital WFSD, standing for World Food Safety Day, and then small letters, certificate. So this is the address that you can download your e-certificate, but then please download it as soon as possible because this link will be disabled tomorrow. So it will be active only 24 hours. And once you go to the website, it will show the link to WeTransfer.com, and then what you need to do is to click download button, and hopefully that will suffice your needs for the certificate. And then we sincerely thank you very much for your participation. Thank you, Lisa from OIE. Thank you, Simone from WHO. Thank you, Gyanendra from WHO, and then thank you, Carla from WFP. And then I have to acknowledge all the people who helped this webinar possible, particularly Asako from OIE has spent so much time to make this technical function workable, to make the Zoom meeting plus YouTube live streaming. Thank you very much. And Sridhar, thank you for the wonderful moderation of the panel discussion. Thank you, everybody, and have a wonderful rest of the day. Bye-bye.